Ozone therapy is one of the most debated treatments in modern medicine. Some consider it a universal cure, some reject it entirely. Others use it without truly understanding what they are doing. Today, I want to talk about ozone therapy for what it really is, where it comes from, the biological principles it is based on, and in which clinical indications the medical scientific literature shows real benefits. Not as an alternative therapy in the naive sense of the word, but as a medical act with a precise history, clear biological mechanism, real indications, and well-defined limits. Today, I'll explain where ozone therapy originates, who made the technology we still use today possible, how it works at the molecular level, and in which clinical conditions it actually makes sense. Hello, I'm Dr. Talia Rossi, an aesthetic physician and a longevity doctor. I work in aesthetic medicine and longevity medicine, two disciplines that, when combined, share one true goal: guiding each woman toward their best possible state of well-being inside and out. Because true beauty doesn't come only from a treatment or an aesthetic result, but from the reflection of a balanced body, a biology that functions properly, and a mind that reconnects with its vital energy. The history of ozone in medicine. Ozone was discovered in 1840 by chemist Christian Friedrich Schonbein, who identified its strong oxidizing properties. From the very beginning, it was used for water disinfection, environmental sanitation, treatment of infected wounds. During World War I, in the absence of antibiotics, ozone was used for contaminated wounds, gangrene, and difficult to heal lesions. Ozone entered medicine as a supportive tool, not as a systemic drug. Tesla and the birth of ozone-generating machines. This point needs clarity. In 1896, Nikola Tesla patented one of the first electrical ozone generators. Tesla did not invent ozone therapy, was not practicing medicine, but he did something fundamental. He made it possible to produce ozone in a controlled, stable, and reproducible way. This is the technological foundation of all modern ozone therapy. Today's medical ozone generators derive from electrical technology made by Tesla, later clinical standardization made in Germany in 1950s. Hans Wolf and modern ozone therapy. In the 1950s, German physician Hans Wolf standardized major autoimmunotherapy, today called systemic ozone therapy, introduced reproducible medical protocols, and brought ozone therapy into structured clinical practice. This is where ozone therapy as a medical procedure truly begins, especially in Europe. Today, ozone therapy is very well used in Germany, Switzerland, and also in Italy. But what ozone therapy really is? In medicine, we do not use pure ozone, but oxygen-ozone mixture produced immediately before use. Ozone is highly reactive, unstable, not accumulative. This means that dose, concentration, route, and timing are everything. There is no generic ozone therapy, there is no detox ozone, and there is no do-it-yourself ozone. There is only controlled medical use. What are the molecular mechanisms behind it? What happens in the body? Ozone does not enter cells. This is crucial. Ozone reacts immediately with membrane lipids and the plasma antioxidants, does not penetrate the cell, and from this reaction are generated very low concentrations of ROS and lipid oxidation products, LOPS. These are not toxic. They act as biological messengers. Hormesis. This is the key principle. Ozone therapy works through hormesis. A controlled microoxidative stress induces improved redox balance, modulation of inflammation. It does not suppress the system, it trains it. NF-κB, a critical clarification. NF-κB is a central transcription factor involved in inflammation, immune response, oxidative stress, and ozone therapy transiently activates NF-κB. This activation is brief and controlled, induces an adaptive response. Over time, studies show less chronic NF-κB activation, less pro-inflammatory cytokines, and more antioxidant capacity. It doesn't shut it down. It does not overstimulate it pathologically, but it modulates it. And what happens to mitochondria and metabolism? Indirect effects include improved oxygen utilization, greater energetic efficiency, reduction of chronic oxidative stress, and this explains why some patients report less pain, better recovery, improved functional energy, and a better metabolism. And what happens to the microcirculation? Ozone improves red blood cell deformability, oxygen release to the tissues, microcirculatory flow, and this is particularly relevant in inflamed tissues, ischemic areas, and chronic pain conditions. What are the main clinical indications? Disc herniation and sciatica. This is the most studied indication. Observed benefits are pain reduction, reduction of inflammatory edema, functional improvement. Often it's used as an alternative or a bridge to surgery. Also, we use ozone therapy with osteoarthritis and joint pain. It's used as symptomatic therapy, pain reduction, and mobility improvement. Always integrated, never used in isolation. And then it's very well known for chronic wounds, ulcers, diabetic foot, thanks to antimicrobial action, improved oxygenation, support of wound healing. In women aged 40-60, how I use it? In my clinical practice, I use it for musculoskeletal pain, persistent inflammation, support in oxidative stress conditions. I do not use it as a hormone therapy, weight loss treatment, or universal anti-aging solution. Longevity is a strategy, not a single therapy, as we already discussed in many videos. Let's talk about the safety and the responsible medicine. Ozone therapy is not harmless, is not natural in a naive sense, and is not suitable for everyone. It is a medical act. It's always important to evaluate every single case. Incorrect routes, wrong doses, or exaggerated promises cause harm. Ozone therapy has a long history, has a plausible molecular mechanism, has a specific clinical condition. It is not a trend, it is not a panacea. It works when it is correctly indicated, correctly dosed, integrated into a responsible evidence-based medical strategy. The problem is not ozone. The problem is not knowing what you're doing. If you want to learn how to distinguish science from marketing when it comes to ozone therapy, subscribe to the channel and hit the bell. Every week, we talk about real longevity medicine, inflammation, pain, the nervous system, metabolism, and therapeutic strategies grounded in solid biology. Now tell me in the comments, what is your biggest doubt or concern about ozone therapy? And if you're looking for a personalized longevity and deep well-being program, you can contact me privately. We'll build your plan together with a medical strategy that truly makes sense for you. On my website, you'll find more content on what I talk about every day, longevity medicine and the conscious beauty. See you in the next video.